My name is Matthew Fox. I'm a GP in Dawlish. I've been a GP for 20 years. I live in Teignmouth and I've been supporting the patients at Teignmouth and Dawlish for 20 years. I spend 1 day a week working for Torbay Hospital as part of their intermediate care team. Every weekday morning, Monday to Friday, we sit down as a group of professionals. So that's a GP, one of the GPs from the local practices. That's our community health team. It involves our occupational therapists, our physios, our community nurses, district nurses, our mental health team as well, and our voluntary sector. Our team isn't just statutory NHS services. Having the voluntary sector embedded in the same room at the same time gives us the potential to really support our whole community.
I'm the intermediate care and therapy lead here at Coastal. And we at the team here work towards ensuring that people in the community are kept safe and at home on a day-to-day basis. My role is very much to support the team in delivering that. So the value of having us all in one room at the same time is really helpful because it's beneficial to bring up not only the people that we discuss as part of intermediate care or in the community, is about the fact that you can bring anyone to the room, and because you've got a wealth of information there and you've got experts in all those different fields, all of us together are able to then figure out the best plan for that patient and on that day.
I'm the Community Services Manager for the coastal locality, so that means I'm responsible for the health and the social care teams that work out in the community to support people in their own homes staying as independent as possible. Enabling cross-working between voluntary sector, health, social care and primary care is absolutely vital in us being able to progress our services to the next level.
I'm the Community Nurse Manager for the coastal locality. My job involves overseeing the work of the community nurses and also the intermediate care nurses and the nurses that work in long-term conditions. So the aim is to have an oversight over the coastal locality of patient need and matching the right nurse to the right patient.
I'm Liam, one of the Coastal Health and Wellbeing Coordinators. Our main role is to deal with the incoming referrals via phone and telephone, liaise with all the patients, relatives and various departments to gather information for the team to assess what a patient's situation is like and what input they need from our team.
Traditionally, people have thought of medicine being you go and see your GP, if you're poorly you go to hospital, when you are better you go back home again. And the only place you could have your care was in a traditional hospital. The world has really moved on, and there's really good evidence that actually if you can support people in their own home, you can actually support more patients than you could just in a traditional hospital ward. So for us, integrated care is actually how do we bring all the parts of our system together to work more powerfully on behalf of our patients.
People in Teignmouth and Dawlish are being urged to have their say about the shape of future health and care services once a new £8 million health and wellbeing centre is built in the heart of Teignmouth. Torbay and South Devon NHS Foundation Trust is planning to build a state-of-the-art new health facility so that GP services, health and care and voluntary sector services can be brought together under one roof in the centre of town, providing seamless care for patients and carers.
To have a centre that is actually on the level in town, a designed building that we've all been involved with, will really enable us to join up the relationships and the understanding of each other's roles, and the pressures on the different areas will really help that working in terms of how we link together to support clients going forward.
The Health and Wellbeing Centre would obviously be a new purpose-built building, so the room size would be government specified, there would be excellent access and good access for disabled people, which will be a considerable change to what we have now. I have been involved in the planning of this building for the last 4 years. We have had many meetings to discuss how it should be built, and we think the building we've come up with will provide everything that is needed to enable many multidisciplinary teams to work in the same building. So we'll be able to talk to social workers, occupational therapists, physiotherapists, pharmacists, and I think that will hugely improve the communication for all the healthcare in Teignmouth to the benefit of both patients and staff.
I think the really exciting thing about combining all of our services in one place is that ability to communicate with one another. It's that sharing of one big room and that sharing of knowledge. by having your general practice and your voluntary sector and your care teams in the same place, you can't help but actually support those patients in at the best possible fashion. Almost think, well, why wouldn't you want them all to be working in the same place to give that sharing and support for each other?
You can find out more by visiting the Devon CCG website.